With all of you today. It's great to see some familiar faces and it's great to see some new faces. So my name is Jan Metz. I work with a program through the California Health Collaborative that's called Every Woman Counts. And our mission is to educate folks on important women's health issues such as breast cancer awareness. We are committed to not only educating the community on the importance of routine screening, but we are also committed to providing services for those in our community who don't have insurance, who can't afford early detection and diagnostic services that everybody should follow. So my presentation today is not meant to be a lecture. I want you all to participate. I'll have questions for you, and you are welcome to unmute yourself and speak up, or if you feel more comfortable typing responses into the chat box, that works well for me too. I just want to make sure that we are inclusive here because I want to hear what you've heard about, what your experiences have been. I want to answer some questions. I want to dispel myths. So with that being said, I am going to move to our first slide, which just basically puts our reality in place. We know that 1 in 8 women will develop breast cancer at some time during her life. That means at least 1, if not 2 of us in this group will hear those words, "You have breast cancer." Now, when we're talking about cancer in general, it's 1 in 3 individuals when we put all the different cancers together. But just when we're talking about breast cancer, it's 1 in 8 women. It is the most common cancer in the United States, in California, and right here in Los Angeles. Now, I want to dispel a quick myth here, though, because while this statistic is talking about women, we all know, right, that men get breast cancer too. In a room of 100 breast cancer patients, while 99 of them are women, 1 is a man. So men do get breast cancer, not as often, but it's just as important that we share the information we learned today, not only with our sister friends, with our family members, but also the men in our life that we care about. All right? All right. So tell me, what do you know about breast cancer?
Well, I don't know anything about it, but my daughter had to have one of her breasts removed, and it's been about 4 years, and now she's undergoing some more treatment, trying to save the other one. So, but all I know, cancer is not a good thing.
No. I know that diagnosis of breast cancer is not a death sentence.
Absolutely, that's correct.
Mm-hmm. It's also abnormal cells that grow differently.
Yep.
And I know that it can metastasize or spread very quickly. I lost my older sister to breast cancer. She died at 45 years of age. She was at a stage 4 and it had spread throughout her body, but she was the type of person who would procrastinate going to the doctor. So I think if she had gone early, she might have been saved.
Yeah.
You bring up some really good points there, Pamela. When we're talking about breast cancer and cancer in general, cancer is a disease that causes the cells in our body to change and grow out of control. And for some cancers, we know exactly why those cells start to change or mutate. We know that lung cancer is typically caused by smoking or secondhand smoke, right?
Mhm.
We know that skin cancer is caused by UV ray, by the sun's UV rays. When it comes to breast cancer, it's not as easy to know what causes breast cancer. But a lot of research has gone into this disease. And what we do know is that if we can find breast cancer in the earliest stages, we can treat it. Now, there's no cure for cancer yet, but cancer can be treated when it's found in an early enough stage. And you mentioned stage 4. So there are typically 4 stages to any cancer, and they're named 1, 2, 3, and 4. Stage 1 is when the cancer is still in the spot where it originally began. Stage 2 is when it starts to spread, but it is still within the same organ. So when we're talking about breast cancer, that cancer has started to spread, but it's still in the breast where it started. Stage 3 is when it metastasizes or spreads, as you mentioned, to the lymph nodes. And then stage 4 is when it spreads to other organs in the body. Hear me out. If we can find breast cancer in stage 1 or 2, the survival rate today is 99%. So Dr. Butler is absolutely right. Breast cancer does not have to be a death sentence. We can overcome it. We can treat it. We can survive. And we're going to talk a little bit more about what that takes. So this is what the inside of the breast looks like. And I like to think of the inside of the breast looking like a bunch of grapes. The grapes, when a woman has a child who is breastfeeding, are nice and plump and round. And the stems are the ducts that lead to the nipple. Okay? When we are not breastfeeding a child, those grapes look like shriveled up dry raisins. That's what the inside of our breast looks like. And breast cancer starts either in those milk glands or in the milk ducts. That's an important part of this, because what we need to realize is that breast tissue starts at our collarbone. It goes all the way down to the bottom of our rib cage, and it includes under the arm. So we're not just talking about the handful. We're talking about all of the surrounding breast tissue, because breast cancer can literally start anywhere in that breast tissue. Okay. Let's see. What else have you heard about breast cancer? Have you heard anything that causes breast cancer or might increase our risk? What have you heard?
That underwires in bras can cause cancer.
I've heard that one too. I've heard lots of different versions of that. Oh, she slept with a bra. Oh, she didn't sleep with a bra. Oh, I used an underwire bra. I didn't use an underwire bra. Well, guess what? Fortunately for us, studies have conclusively found no correlation between whether you wear a bra, don't wear a bra, wear an underwire, don't wear an underwire, sleep in a bra, don't sleep in a bra. You can make that decision for yourself, knowing that it will not affect your risk for breast cancer.
And another thing, my family, immediate family, thought you could inherit, not inherit it, but it could be in the genes.
So
But,
that
I
is,
don't really know, because my son, he had prostate. I had 2 cancerous issues with my throat. I don't smoke, never smoked. And my daughter, she had breast cancer.
yes. So some cancers do run in a family. However, it's not typically throat and prostate that go together, or prostate and breast. If somebody has 3 family members in the same family line, so not an auntie from this side and a cousin from this side, but 3 individuals from the same line, there is a little bit higher risk for somebody getting breast cancer. There's also if an immediate relative, so mom, sister, or daughter, not an auntie, not a grandparent, but mom, sister, daughter, if somebody was diagnosed before the age of 50, there's also a higher risk for their primary family members to get breast cancer as well. So in some situations, yes, for individuals who inherit the BRCA1 or BRCA2 mutation, they are at higher risk. However, that doesn't mean that everyone in that family will get breast cancer. And it doesn't mean that if you don't have anybody in your family, that you can't be the first. So I'm glad you bring that one up. What else have you all heard?
Is it proven now that birth control pills may cause breast cancer?
So birth control pills, while they don't cause breast cancer, long-term use of anything using hormones can increase our risk. Now, not all individuals who have breast cancer have hormone-induced breast cancer. However, for people who are prone to estrogen positive breast cancers, taking birth control pills, patches, rings, injections, whatever it is, or using hormone replacement therapy during menopause can increase our risk. That is actually true. So that one is a little bit of a individual decision. I use an example of my own family. I have 2 aunties who, when I was in high school, were going through menopause. And one of them was more of the crunchy type, didn't want to take hormone replacement therapy because she didn't want to expose her body to anything that wasn't natural. But the symptoms she was experiencing from menopause were so much that she lost her job, her marriage was falling apart, the relationship she had with her kids had been impacted, and her quality of life had really plummeted. So I remember these conversations about how she really needed to consider doing something because it seemed like everything was crumbling around her. Now, I had another auntie who was going through menopause as well, who was inconvenienced by an occasional hot flash, who didn't like some of the things that were happening, but she was fortunate to be on the mild side. And I remember her complaining that her doctor wouldn't put her on hormone replacement therapy because they didn't feel like it was worth the risk. So we have to judge our risks, right? If our quality of life is affected, then it's worth that risk. If not, maybe it's not. But we do know that prolonged use of any type of hormone replacement or oral contraceptive, any kind of contraceptive, actually, not just the pill, because we're talking about the IUD that has hormones, the patch, the ring, any of those hormone options do increase our risk. What
Men
else?
can get breast cancer also.
What was that?
Men can get breast cancer also.
Absolutely. Absolutely. And we started this conversation saying that, right? In 100 breast cancer patients, one of them is a man, 99 are women, and 1 is a man. And some people would say, well, then what does estrogen have to do with it? Well, we all have female and male hormones. Men have estrogen and progesterone, just like we have testosterone. We just don't have as much. But there's also the fact that not all breast cancers are hormone positive. So there's a lot we're still learning about breast cancer as well. Absolutely. Thank you for sharing that. What else have you all heard?
What about deodorant? That certain types of deodorant can cause breast cancer.
So while it's not actually the deodorant, that there's some founding truth there. A type of aluminum that used to be used in antiperspirants to prevent us from sweating had been linked to increased rates of breast cancer. Now, since that discovery, that type of aluminum is no longer allowed to be used in any body products. However, we still have to think about what it might have been replaced with, right? Same thing when people say, oh, my plastic bottle is BPA free. Well, I'm glad there's no BPA in it, but what's in it now, right? Is whatever they substituted for BPA healthy? We won't know that for another 20 years of research, right?
Yeah.
So we have to be cognizant of that. And also, if you think about what an antiperspirant does, it blocks our body from a normal process of sweating.
Yeah.
Sweating allows our body to release toxins. It allows our body to cool down. And people are so accustomed to, and there's no judgment because I'm over here too, and it's something that I've used. We're putting something on our body to tell our body not to do something that's healthy, right? It really is the deodorant that is more of the issue, right? We don't want that sweat to smell. So yes, I'm glad you put that. I'm glad you mentioned that one. What else have you heard?
That there are certain foods that can cause breast cancer?
There is a lot of research going on about food. We've all heard lots of different things about we are what we eat, we are what we put on our skin. I mean, the biggest organ of our body is our skin, right? Everything that we come into contact with definitely affects our body. There are no foods that have been identified yet as this increases our risk for breast cancer. What we know when it comes to breast cancer, though, is that healthy nutrition overall not only reduces our risk for breast cancer, but if we were diagnosed, the healthier we are going into a diagnosis, the easier that treatment regimen will be, and the more likely we will be able to survive the cancer and the treatment. Absolutely.
I've heard that being overweight or having too much fat in your diet can cause breast cancer.
So what we know is that estrogen links to fat. It's like a receptor. So the more fat cells we have in our body, the more estrogen we're holding on to naturally, because fat holds on to that estrogen and doesn't let it go. And so for those individuals who are at risk for hormone positive breast cancers, the more hormones we have in our body, the higher our chances of getting that cancer would be. So when we talk about reducing our risk factors, one of those things that we will talk about is maintaining a healthy weight, especially after menopause, because we do see that after menopause, being overweight does increase our risk for breast cancer. Absolutely.
This question is about the men. What are the main how do most men know that they may have breast cancer? What's the best way for men to check?
Men typically find their own abnormalities because most of them have less breast tissue. Men typically have less breast tissue hiding those abnormalities, not all of them, but most of them. So men typically find them themselves either during a shower, they accidentally rub against a lump or a bump. We'll talk about some of the signs and symptoms, and those signs and symptoms are the same for men and women. Absolutely. Great question.
Thank you.
I wanted to ask if age has, if you're, for example, if you're 60 or older, is there a less risk factor for you getting breast cancer?
Believe it or not, 80% of women diagnosed with breast cancer have no known risk factors except for two things. They have breast tissue and female hormones, and they're getting older. So believe it or not, we are at higher risk for breast cancer after the age of 50. That's not to say we don't have youngsters being diagnosed with breast cancer. About 15 years ago, I had a 7-year-old in our program who was
Wow.
diagnosed with breast cancer. 7 years old, the baby. She is doing really well today. But it's not to say that younger folks don't get it, because they do. And sometimes it's a little bit more aggressive, especially among the African-American community. However, our risk increases the older we get.
Excuse me, you said breast cancer on a 7-year-old, and I'm thinking, would it be chest cancer? Because I don't know how early children's breasts start growing, but mine didn't start until I was like 10, and my mom was surprised at that.
So imagine this. This is what the inside of the breast looks like. Whether or not we have all of the fatty connective tissue around it, we are born with milk glands and milk ducts.
Okay.
Men and women. Evolutionarily speaking, men no longer produce milk. There are theories that they might have once upon a time. However, we all still have milk glands and milk ducts. Our breast tissue, meaning the connective tissue, the fatty tissue that forms the actual perky breast, doesn't develop until later, but the glands and the ducts are still there at birth.
Oh, okay. That makes sense.
Just an aside, sometimes we see babies that, when they're newborns, the hormones from the mom have affected their breasts, so they look like they have, little small developed breasts. So yes, that breast tissue is already there.
Yep.
Wow.
Absolutely. Now, there are other risk factors, and you all have covered a few of these. Family history, being overweight, having the mutation in the BRCA1 or BRCA2 gene. But there's a couple others in there that I want to point out. Those of us who started our periods before the age of 12 or didn't go into menopause until after the age of 50 are at higher risk for breast cancer. The reason there is because it's more years of exposure to estrogen and to the high levels of hormones that our body exposes us to during childbearing years. In that same science, we've got not having children and not breastfeeding, because while we are pregnant, while we are breastfeeding, the hormone levels change in our body, which is a protective factor to breast cancer. Now, those aren't things that we go out and tell people to like have kids early, have lots of kids, but it's important for us to know what our own risks are. And so if we haven't had children, if we weren't able to breastfeed, if our period started before 12, or if we didn't go through menopause until after 50, we might consider ourselves lucky, or healthier, but in fact, our bodies are exposed to those hormone levels for longer periods of time, increasing our risks. And despite the fact that up till now, it sounds pretty scary, there's lots of risk factors that we can't do anything about. And 1 in 8 of us will be diagnosed, meaning 2 on this particular call right now. There are things we can do. First and foremost, we need to know our family history. We need to talk to our healthcare provider about what our risk for developing breast cancer is. We can eat a wholesome, healthy, nutritious diet. I'm sure you all have heard our plate should be half what?
Vegetables.
Vegetables.
Yes, half vegetables or fruits and vegetables.
Mhm.
That's not typically what our plates used to look like, is it? There
No.
used to be a little side of vegetable on our plates. It's
Mhm.
really important that we fill our diet full of fresh fruits, vegetables, and whole grains, low fat protein sources. I'm not saying you can't have a hamburger, but you shouldn't have a hamburger every day. I don't say you shouldn't have pizza, but maybe you have a slice of pizza with a salad instead of 6 pieces of pizza, right? It's about moderation. We know that we need to avoid smoking and alcohol. While some individuals are unaware of this, smoking doesn't just affect our lung cancer risks. Individuals who smoke also have a higher risk of breast cancer. And any amount of alcohol increases our risk for breast cancer as well. And getting active. We talked about maintaining a healthy lifestyle, maintaining a healthy weight. We can't do that if we're not active. And what we know is that as little as 10 minutes of brisk walking every day can reduce our risk for breast cancer. 10 minutes. Now that walk does not involve a cup of coffee and a girlfriend that we're chatting with. We got to walk fast enough that our heart is beating faster and our lungs are working harder. So we don't want you not to be able to talk. You should be able to see somebody and say hello. But if you are, quote, exercising and you can sing along to your favorite song, you're not working out enough. All right. That's a good way to judge if your exercise is enough. And for some people, you could be running a marathon and still be able to sing and be able to push yourself more. And for others, it is a jaunt around the block. So find where you are now. Start where you are now. Add 10 minutes of exercise to your day if you can. And so we need to know our risk, reduce our risk, and then we need to be mindful of early detection. As I mentioned on one of our first slides, if we can detect breast cancer in the first or second stage, the survival rate is 99%. So what does that mean? It means know what's normal for your body. Did you know one boob is bigger than the other? Did you know that your nipples don't point in the exact same direction? Did you know you have normal lumps and bumps?
Yep.
Know what's normal for you so that if you notice anything on this list, you can tell your provider about it. So yes, people talk about new lumps and bumps all the time. That is the most common thing people are looking for, but it's not the only thing to be mindful for. And this is the same thing for men and women. Okay. So a swelling of the breast, the turning in of a nipple, flaky or discolored skin, an unprovoked nipple discharge. So obviously we're not talking about breast milk. And if you squeeze a nipple long enough, something will come out. So this is literally, you take your blouse off at the end of the day, you take your bra off at the end of the day, and you see that there was some secretion, there was a discharge. That's something you want to let your provider know about. Any new marks, any new dimples, any change in the size or the shape of your breast. Know yourself and know what's normal so that you could tell somebody if something ever changed. And of course, pain in the breast. Now, we're not talking about a pain that comes and goes. Sometimes it's there, sometimes it's not. Some weeks it's more noticeable than others. That all has to do with our hormone cycles. But if you have a new pain that doesn't go away or only continues to get worse, that's something you want to let your provider know about. Okay. So breast self-awareness is the first step to early detection. We used to call this a breast self-exam, but we no longer do that because what we found out is that people heard that word exam and they were worried, am I doing it the right way? When do I do it? How often do I do it? People were worried about that. There's no wrong or right way to do the breast self-exam. If you want to do it, if you want to get to know yourself in the shower or laying down in bed, if you want to put that towel behind your shoulder or not, there's no right way or wrong way to know your body. Just know your body. Okay. And then the second step to breast cancer early detection is a mammogram. It is the only approved way to find breast cancer early. There are other scams out there, or there are scams out there, not other scams. There are scams out there that will tell you there are alternatives to the mammogram. They are not approved. They actually don't even scientifically do what they claim to be doing. The mammogram is the best and only approved way to find breast cancer early. And in fact, it can find an abnormality not only that's too small for you or your provider to feel, but could find something 7 years before you may be able to feel it. And when we're talking about early detection, 7 years is a good thing. Most individuals will be recommended to start mammograms at the age of 40, and they'll be recommended to get them every year. But talk to your provider. You may need to start mammography earlier. Talk to them about your options, but the typical standard is age 40 every year.
To how long? Is it for age 40 plus years or?
Good question. So mammograms never technically end. There's no age where we say at the age of 80 you can stop. What happens is mammograms are recommended as long as you feel like you're gonna live another 10 years. And if that mammogram found breast cancer, are you healthy enough to go through treatment? Another story on my family side. My grandmother, who passed away at the age of 96, had mammograms up until around the age of 82 or 84. At that point, her health wasn't great. She suffered from dementia. She had no interest in getting a mammogram because at that point we had really talked as a family and realized that she wouldn't have been able to go through. She wasn't a candidate for surgery or chemotherapy or radiation. So ethically, for us to continue mammography on her would be selfish, and nobody needed to know if she had breast cancer if there was nothing we could do about it. Now I have a 96-year-old grandmother now, so that was.
Could I get your?
What was that?
I'm sorry, you were still speaking? Someone's still speaking?
Go ahead.
My internet connection's a little bit slow. I'm sorry.
It's okay.
Could I get your opinion on MRIs versus mammograms?
Yes.
The image resolution?
Yes. Let me finish this segment and then I'll tell you, I'll introduce the use of MRI. So I now, 20 years later, have another grandmother who is 96 and continues to get mammograms because, bless her heart, she is, other than not being able to hear very well, she is very healthy and she still undergoes hip replacement, joint replacements on the regular, but walks 3 to 5 miles a day. So she still gets mammograms because she says, I could go through treatment if I needed to. So there is no age at which we say you should stop mammograms. After the age of 75, it typically becomes a conversation with your doctor, but there's no age at which we stop. And that's different from our cervical cancer screening. Those Pap tests don't have to go on forever. Once we've had 10 years of good results and we are over the age of 65, we're good to stop. So mammograms are a little different. Now, to your question about MRI screening, MRI is not used for the general population because MRIs are really sensitive. So when you have an MRI, every little thing will light up. So MRIs are used just for cancer survivors. as they usually alternate them with mammograms. So you would have a mammogram and then an MRI and then a mammogram and then an MRI, just to monitor for reoccurrence. They come up with so many false positives that it is not ethical to use them as a routine screening mechanism in the general community. For survivors, it's used. For individuals known to have the BRCA1 or BRCA2 mutation, it's also used, but not for general screening. Does that answer your question?
Yes. Yes, I would like to add that sometimes your doctor, if you have been diagnosed with breast cancer, your doctor will order an MRI for further testing. And also just want to share, I have a friend who's going through a treatment right now. And there was, the cancer was found in her lymph node, and they couldn't find, the cancer in her breast from the mammogram. And so they figured that, well, if there was cancer in the lymph node, it had to be somewhere, in the breast. So they did recommend the MRI, to further, explore the breast, and that they did find it on the MRI, but they didn't find it on the breast with the mammogram.
Right. And sometimes they'll use MRIs. Sometimes, I mean, they often will also use PET scans. So it all depends on the case, but yes, absolutely. Absolutely. So yes, it's used as a diagnostic tool more than just routine screening.
And isn't that the way they find breast cancer in men? Is through an MRI? I have a friend who had breast cancer, and he ended up having a double mastectomy. And he found the lump, and it was his dad had breast cancer.
Mhm.
And he found the lump in his chest, and it was confirmed. I asked him, well, what did they do for you? How was it found? Because I don't think you can get a mammogram. And he said that it was found through an MRI.
So typically, if a man or woman finds a lump, the first step is an ultrasound. If they weren't able, because what an ultrasound does is it's able to look at that lump that you can feel or that you can see on a mammogram and determine whether it's a liquid-filled cyst or a solid tumor mass. And then if it is a solid tumor, they can use ultrasound-guided needle biopsy to remove those cells to determine if they are cancerous or not. If they're not, it would be considered benign. If they're cancerous, it's called malignant. And an ultrasound is usually the first step. They probably followed up with MRI to see if there was anything else going on. It's not usually the first stage, especially if you felt a lump.
Okay.
Yep. Absolutely. So what gets in the way of screening? Why don't people go for their mammograms?
Fear.
Fear.
Yes.
Some people say they'd rather not know.
Some don't have insurance.
Some don't have insurance. That's right.
Some say it's too painful.
Some say it's too painful. Yep. I would argue that I've worn more painful shoes for an entire wedding, an evening at a wedding, than a 30-second mammogram, but I'm not judging anyone's sense of comfort. A mammogram is no fun, but fortunately it only lasts 30 seconds.
Feels like it's longer.
It does, doesn't it? It sure does.
The way they slap it down.
Exactly. I always go into my mammogram saying, I'm really sensitive. Would you be really gentle with me, extra careful? And I've had some who just look at me like, everyone says that. And then other people who I actually think it helps. And they've, kind of tried to warm up that little plate or whatever, but I always try to make my appointment for the first thing in the morning because I don't want to be the 40-second mammogram somebody's done. I don't want to be the person that's holding them up from going to pick up their kids or going to make dinner. I want to be the first one in the morning when everyone is hopefully in the best mood of the day. Absolutely. So one of the major reasons we know that people don't get screened is because it can be expensive. Maybe not the mammogram itself, but if something were to happen, people fear what it would cost. So this last slide I have, and then I'll open it up to more questions, is about the fact that our program, the Every Woman Counts program, offers free breast and cervical cancer screening services to anyone in the state of California who needs it. Free diagnostic testing for anyone who needs it, meaning if you don't have insurance or you can't afford your copay or deductible, and if you're at or below the 200% federal poverty guidelines, and that is self-reported, we don't ask for proof of income. It is just a question you are asked and you get to answer. We provide these services for free, and anybody who would be diagnosed in our program would be eligible for the treatment program, which covers all the treatment. So if you know anybody whose real reason that they don't get a mammogram is because they can't afford the services, please share our information. I'm going to open it up for questions, but I am also going to drop a link